Welcome to the Healthy OC segment on Real Orange. I'm Heidi Cortese. Stroke remains the #1 cause of disability in the United States. Prompt medical treatment can provide a huge advantage in surviving and limiting stroke effects. Our guest will explain why stroke neurology receiving centers are essential. We welcome Dr. David Brown, Medical Director of Hoag Hospital Stroke Program. Welcome, Dr. Brown.
Thank you, Heidi.
What is a stroke?
Well, a stroke is a clinical syndrome where a focal part of the brain is affected, and it causes symptoms including numbness or weakness on one side of the body, typically involving the face, hand, arm, and or leg on one side of the body, although it can affect both sides. Also, vision can be affected suddenly. There can be a sudden change in speech. There can be a sudden disability in walking, or the worst, headache of the patient's life. This is caused by a blood clot blocking off an artery, diminishing the blood flow to that part of the brain, or alternatively by bleeding into the brain.
Now, there's an acronym, FAST, F-A-S-T. Could you please explain what that means exactly?
Yeah, we like to teach patients and family members FAST, where face is the F, and we ask the patients to smile and to see if one side of the face is drooping. A is arm. We ask the patients to raise their arm. Does one arm drift downward, or are they unable to lift that arm? S is speech. And we ask the patients to say a simple sentence. Do they slur their speech, or are they unable to say this phrase? And T is for time. Time is of the essence. Act fast. Call 911 immediately. Brain cells are dying.
When a person calls 911, let's say they're the person having the stroke, will the EMTs know to take the person to an emergency center that specializes in stroke treatment?
Yeah, I, as well as other stroke specialists in the county, worked with county EMS officials to help develop a system whereby EMS are trained to recognize stroke symptoms and bring them right to a comprehensive level stroke center.
So the most important thing a person can do if they or a loved one is having a stroke is to pick up the phone and call.
That's right. It can't be emphasized enough. Calling 911 is the most important thing a patient can do if they think they're having a stroke.
What are some of the acute stroke treatments available today?
Okay. Well, the mainstay of acute therapy is something called IV TPA, or an injectable form of tissue plasminogen activator. And that's a chemical that's found naturally in our bloodstreams, but we give a concentrated bolus of that to try to break up the blood clot. By doing that, we hope to minimize the stroke symptoms or even cure a stroke in the best possible situation. Now, that can only be given in most cases up to 3 hours, and at other times up to 4.5 hours with special circumstances. Another option we have at a comprehensive level stroke center is something called Intra-Arterial Therapy, and that's where an interventional radiologist guides a catheter, a very small tube, up to the area that's blocked off, and can either release clot-busting medicine right at that site or use a specialized catheter to try to remove the clot. And that can be done up to 8 hours in most cases.
Could you please tell our viewing audience exactly what a stroke neurology receiving center is and why that is so important?
Okay. Well, Hoag is one of 6 centers throughout the county, Orange County, designated as a stroke receiving center. Those are comprehensive level stroke centers that can give both IV or intravenous TPA as well as intra-arterial. We have stroke-trained neurologists available 24 hours a day, as well as interventional neuroradiologists who do the interventional procedures, the intra-arterial procedures. We also have neurosurgeons available 24 hours a day if that's necessary. We have updated stroke protocols that are based on evidence. We have cutting-edge neuroimaging diagnostic techniques where we can rapidly and without intervening in the patient's body, see the brain very quickly, see the blood vessel that's blocked off, and also see the area of brain not receiving adequate blood supply.
Well, unfortunately, we're out of time. Thank you so much for this wonderful information.
Thanks for having me.
And everyone remember, call 911. That wraps up this week's edition of the Healthy OC. Wishing you a healthy and happy new year. I'm Heidi Cortese.